So I am Sheila Bogdanowicz. I've been with Rose Community Foundation for 15 years. The foundation was created in 1995 when Rose Medical Center was sold. And Rose Medical Center was created a year before Dr. Carmona was born. At an interesting time this is just post-war, a really interesting time in our country's history. And I tell you about this because many of the values of Rose Community Foundation really came from Rose Medical Center that was created by the Jewish community to allow Jewish doctors who at the time did not have equal practice privileges at local hospitals. That also meant that doctors of color did not have practice privileges. In fact, were not allowed to be in the American Medical Association. The first African-American doctor was admitted on staff at Rose Hospital. So the first in the state admitted was at Rose Hospital in the 1950s. So that sort of history of discrimination is something that it's a value that Rose Community Foundation has to this day. So when there was so much anti-immigrant rhetoric in Colorado and probably other parts of the country in the early to mid-2000s, many of us at the foundation said, look, we have resources, we can influence change. What can we do to change this? Tackling immigration was way too big, and that was something at a federal level. But we really felt that what we could do is somehow highlight all the positives in the Latino community. And the Latino Community Foundation of Colorado was born and launched in 2007. We've been so, so proud of what Elsa Holguin and I think it was the two of us, and Carolyn Waller joined us as we thought about what this could look like. And so we have this fuzzy vision. It wasn't very clear, it wasn't very clean, it wasn't totally articulated, but we felt it had great potential. And guess what we're seeing today? We're seeing potential in action. And this is the vision that we didn't have that the Latino Community Foundation of Colorado is creating for itself. And I'm just so, so proud to be part of that. And now it's my privilege to introduce an exceptional man. And I told him just before I came up that he and I share, our beginnings are similar, because I was born into a very poor immigrant family, as was Dr. Carmona. But our paths took very, very different directions after that. He was born in New York City. I'm from Denver. He experienced homelessness, hunger, and health disparities in his youth, and probably those experiences influenced the rest of his life. He dropped out of high school. He enlisted in the U.S. Army in 1967, that's Vietnam time, and received his GED while in the service. He left the military as a decorated Special Forces veteran. He then went on to pursue a college degree and entered medical school at the University of California in San Francisco. He became a surgeon, so that wasn't just medical school. Then there was the surgery part. And he later established the first trauma system in southern Arizona. So while being a doctor and doing all kinds of fabulous work for community, he started his second or maybe third career. And that is that he went back to school and got a master's in public health policy and administration at the University of Arizona. In 2002, he became the 17th Surgeon General of the United States. Unbelievable, right? when you talk about resilience, I think it's written all over him. He completed his 4-year term. He then joined Tucson-based Canyon Ranch as vice chairman. He is currently president of the nonprofit Canyon Ranch Institute and distinguished professor at the University of Arizona. This is one remarkable man. Welcome, Dr. Carmona.
Thank you. Thank you, ladies and gentlemen. Sheila, thank you for the nice introduction, but I often feel like Ricky used to say to Lucy, you got a lot of splaining to do. Now, it doesn't engender a lot of support from your peers when they find out their Surgeon General's a high school dropout. Of course, many of you just think after all that, well, it's just another federal appointee, what's the big deal? Well, I'm thrilled to be here with you for many of the reasons that you've heard already. But what strikes me is that having the opportunity as Surgeon General of the United States to not only travel the country but the world, I've never seen an organization like this. I've seen many Hispanic organizations. I've not seen anybody pull together a community around the needs of the viejitos, the elders in the community. And I think that's a wonderful, wonderful testament to the culture and all that the elders have left us with, the legacy of culture, the legacy of work ethic, the legacy of integrity, of family that is there. And I know you all appreciate that as much as I do because it made a big difference in my life as well. So I'd like to talk a little today on the uniqueness of the Latino aging in America. But first and foremost, give thanks to the Latino Community Foundation for the privilege of being among all of you who are so passionately involved in policy and programs that will support the aging Hispanic community here in Colorado. Congratulations to the Colorado Latino Age Wave Initiative, which I just thought was fantastic when I read about the history, and evolving now to the Colorado the Colorado Aging Resource Center. You know, one of the things that I've recognized through all the years, especially as being Surgeon General and going to so many communities like this, is that what makes our nation so strong is the diversity. Yet the paradox is it's what separates us also. And it creates the struggles that are still ongoing today. Sheila recounted, and being a historical buff myself and learning a lot of history from my own abuelita as I grew up, which I'll tell you about. But there's still a great deal of inequalities. There's still a great deal of covert discrimination, if you will, and inherent biases even from people who don't realize that they are biased in their decision making. And it's really organizations like this that shine a light on those discriminatory practices and allow the true people to emerge and really take their earned seat in society. So again, my applause to all of you for what you're doing. Now, a little bit about being Surgeon General. As you heard my background, I was one of 4 children of immigrant parents who spoke English as a second language. My abuelita, who brought the whole family in, never spoke English her whole life. She died in her 80s. Toughest woman I ever met, with the most integrity, about 5'2", 100 pounds soaking wet, and was just the most fantastic person. And I never realized in growing up how much she would affect my later life, because as a child, you know, it's abuelita, you know. And I grew up at a time when there was a great deal of discrimination. I grew up in a neighborhood called Harlem in New York City. And so if you stayed in your hood, things were okay because everybody looked like us. They were all brown or black. But when you stepped out of the hood, there was a great deal of discrimination. And so most of my generation, as we grew up, we didn't speak Spanish. My father was the youngest of 27 kids. Yeah, abuelita was a saint, I told you. And I had every one of my tios y tias, they spoke Spanish. And abuelita lived in this little tenement. And on Sundays, she'd cook all day and feed everybody. And they all lived in the same area, but they'd come in and they'd pay homage to abuelita, who was the matriarch of the family. I mean, she was truly the queen of the family. Now, Abuelo thought he was, but that's only because Abuelita let him believe he was. She really controlled the family. But often it was my Abuelita who said to me, after she would ask me questions, and I'd respond in English. And she'd say, Ricardo, si quiere dinero, necesita que pídame en español. Ricardo, si tiene hambre, necesita que pídame en español. Meaning, if you want money, you got to talk to me in Spanish. You want food, you have to talk to me in Spanish. And I was really upset with that because I knew out in the streets that wasn't helping me because of the discrimination that we all faced during those years in the 50s and the 60s. But yet, as I aged, I recognized how smart she really was because she never wavered from who she was and how proud she was to be a Hispanic immigrant in America. Never once wavered. And in fact, always told me, be proud of who you are. Don't hide from it because you can be as good as anybody else. Education will set you free. So with that background and a mom whose goal in life, Mom spoke in Spanglish. And she would often say, I just want to live long enough to go to one of my kids' graduations. And all she meant was high school because nobody in the family had been out of high school. Yet she worked hard. She had problems with substance abuse. My father did as well. We were homeless. We ran the streets. Tios y tias took us in. Friends took us in. But it was a very uncertain life. So I wasn't a good student because, as you know, even today, when a child doesn't have a stable environment, when they don't have a loving family, when they don't know where they're going to be sleeping every night, homework is not an issue. Survival is an issue. And yet, in our country today, 20% of children grow up in poverty. Almost half the children in the United States will be in some type of a support program, local, state, or federal, by the time they reach adolescence. This is the greatest nation, most rich nation in the world, and our most precious resource is struggling. And the responsibility we have, and I felt as Surgeon General this tremendous burden, was every birth is an opportunity to create a success story. And if we don't, that birth becomes a liability to society. And we pay for that liability for decades to come, for a whole lifetime. So you heard my out at 17 years old with no place to go was joining the Army. And the Army taught me a lot, not just to be a good soldier, but it taught me about duty and honor and country. The recruiter, when they recruited me at 17 at the peak of the war where I had no place to go, said, son, if you sign the paper, we're going to make you all you can be. And he wasn't lying. I had no idea what I was in store for. But yet it was a transformative experience in my life because for the first time in my life I was being really held accountable. My abuelita and my mom tried, but we didn't listen much. Obviously they weren't as smart as we were at that age. But like Mark Twain said, he said, I can't believe how smart my father became when I was 21. I feel the same way about my mom and abuelita who struggled. And my papa was a good man but had a life in the street, and he struggled as well. And the kids kind of were on their own a lot of times, even though mom did the best she could. So that event changed my life. But my success eventually, after multiple failures, because really the only difference between a person that succeeds and fails is the person that succeeds gets up one more time. My success is really a testament to this great country who still struggles and has problems and blemishes, but it is still the best country in the world, where opportunity abounds for anybody. If you want to work a little harder, if you want to stay up a little later, if you want to get up a little earlier, if you want to be an innovator, if you want to be an entrepreneur, if you want to take some risk, this is the place to do it. Few places in the world can you be born to poverty, homelessness, poor education, and then become the Surgeon General of the United States. It's a great country. As you heard, I always had a plan A and plan B, but I kept working hard. I've worked a lot of jobs in my life. As you know, I've been a soldier, I've been a police officer, I've been a paramedic, a registered nurse, physician's assistant, teacher, ocean lifeguard, So you're all thinking, well, hell, this is just a guy that couldn't keep a job. Yet, every one of those jobs was extraordinarily important when I ultimately became the Surgeon General of the United States, as we embarked on 2 wars, as we were dealing with everything from avian flu to SARS and all the other problems, including obesity and the public health issues of the day. Getting there was a real challenge. As I got through my tour in Vietnam, I never thought that I was going to leave the Army. I thought I was going to make the Army Special Forces a career because I'd been promoted. I had a position of leadership. I was wounded in combat, but I made it back. A lot of my friends didn't, and that still weighs heavily on me. It's painful to go to the wall and see the 58,000 names, and I know on each panel where all of my buddies were. But yet I was fortunate to come back, so what the driver was, what am I going to do with this opportunity? And as I dwelled on that, and I had my GED, I thought, maybe I should go to college. But to be honest with you, my plan was to stay in the military because it was a safe place for the first time in my life. I had a job, I got 3 squares, I got to see the world. But my team in Special Forces kept saying, you need to go to college, Carmona. I was a Special Forces medic and a weapons specialist. And I knew that I couldn't get in because I'd not done SATs or PSATs. And it was embarrassing. It was humbling, quite frankly. But after a while, they kept pushing me, and I said, all right, I'm going to apply. And the only reason was it was a strategic plan. I knew when I applied they were going to reject me, and then they would stop bothering me, and I would just stay in the Army. And I applied to dozens of schools, and I got the rejection letters, which was humbling, because everybody thought, well, you're a pretty good guy in the Army. How could they reject you? But they didn't know my background. And for many years, I never spoke about it because I was embarrassed. And then one day, the letter came in from a community college, Bronx Community College in New York, and it said, congratulations, you've been accepted. I was, oh, shit, I got to go to college now. And I went, and it was humbling because the first year, you just take remedial courses. And I sat with smart kids, and I wasn't that good a student because I had to do everything that I hadn't done before, including learn how to study. But eventually, I became an A student, working all those jobs. And eventually, I moved out west, finished college there, graduated at the top of my class. And I was fortunate that I applied to a lot of medical schools, and I got into several. And I chose University of California in San Francisco because it was the most diverse medical school in the country. It was 1976. For those of you who know San Francisco, the medical school sits right adjacent to Haight-Ashbury in there. So there was always a cloud over the medical school. Everybody was happy. Everybody was happy. But at a time when you didn't see much equality for women, a third of our medical school class were women. Had the highest rate of Hispanics in the country in medical school. Diversity was a big priority for the University of California early on. And I thought, I feel at home here. So I went and I worked hard, and I never got into the stress that all the normal kids in medical school have, because medical students always complain, there's too much to work, it's too hard, there's too many books, I'm never going to make it. Then they kind of form these little groups, and they feed off of one another. And it becomes very stressful. I never did that because, to me, this wasn't stress. These kids didn't know what real stress was like. And I went to classes, and then after a while I didn't go. I just read the syllabus, and I was very focused and regimented and disciplined, skills I learned in the Army. And because of that, I skipped my last year of medical school, and I graduated #1 in my class at the University of California. And you heard my colleagues in nursing and paramedicine and everything often chided me because I became a surgeon, and really because they said, well, when you ask a surgeon to name the best 3 surgeons in the world, they always have trouble naming the other 2. And I became a trauma surgeon, but I kept working. In fact, even when I was a doc, I was still working as a police officer because I loved that emergency response and community stuff that I was doing, and I didn't let it go. But during that time, I went back to graduate school, as you heard, and then I got a call one night and it was White House personnel. And they said, Dr. Carmona, would you like to be considered for a job in Washington? Would you be willing to go back on active duty, back in uniform? And I called, and I thought, well, obviously this is a mistake, this call. There's another Rich Carmona in the country because there's no reason for the White House to call me. I have been pretty critical of both parties and the poor, I should say, lack of leadership and poor leadership that's exemplified by both parties. I've actually been bipartisan, but in a way that has been maybe incriminating to both parties. So the point is, there was no reason for them to call me because I didn't call in any favors. But when I talked to the young man the next day, and he said, well, I said, well, what's the job? He says, the president will be recruiting for a new United States Surgeon General. We'd like to know if you'd like to be considered. And I kind of laughed and said, okay, fine. But I knew that in a couple of weeks, they'll figure out they got the wrong guy, and I'll get sent home. But I thought, there's no downside. I'm gainfully employed. I'm a professor at the university. I'm teaching. I'm doing all these things, and I did it. And eventually, I went through the process, which is a very intrusive process and sometimes malicious. As you know, when you become a public figure, you start being, incriminated and related to crimes that occurred before you were born. It becomes a circus. It's not really professional vetting. It becomes a circus and a feeding frenzy. And you all should be concerned about that, because when I was Surgeon General and I was trying to recruit smart young men and women, especially to exemplify diversity, especially in the Hispanic community, I had people tell me, yeah, I'd like it, but I won't go through that crap that you went through. We lose as a society because the system has become so malicious and such an entertainment tonight kind of an event that people are not willing to serve selflessly anymore, and we lose because we don't get to the good, diverse representation that we deserve. We need to fix that system, folks. So I'll finish up on this part. During the process of all these phone interviews, I had put a little card in my pocket, and I had written out, because I knew that I was going to get rejected on one of the calls. And I got through several calls, and then they said, well, Dr. Carmona, would you be willing to come to Washington and interview? I said, are you guys paying? And they said, yeah. So I had a little card in my I wrote this little card out. I called it my rejection speech with dignity, because I knew they were going to reject me, and I knew when I got rejected, I wanted to have something positive to say. And the calls just came in randomly, because it's not like the White House schedules anything. And so the statement was essentially saying, thank you for your consideration. Please let the president know I'm willing to come back on active duty if there are other leadership positions, and I appreciate this opportunity. I always had it in my pocket. So I start going through meetings with the famous people in Washington, secretaries and such, and finally, after a couple of months, I get a call, and it's the White House Chief of Staff. So my secretary called me, I pick up the phone, I took out my card. And I knew that this was going to be the rejection part, that, for 10 minutes they'll tell you what a great American you are, but the last 30 seconds is, but we're going to accept somebody else. And he said, Richard, I said, yes, Mr. Secretary. He said, what are you doing on March 26th? And I said, okay, it's another interview. He said, no, I really want to know what you and your family are doing on the 26th. And I thought, oh, hell, they want to interview my kids. I will never get this job. And he says, Richard, hang on a second. He said, I should have told you. The president just met with the leadership. The president has made his decision. He'd like you and your family to come to the White House on March 26th, where he will announce to the nation that you will be the nominee for Surgeon General of the United States. And I said something brilliant. I said, you're shitting me. And he said, no, sir, I'm not. So your life changes. You become a public figure overnight, and eventually you go through the second part, because you're not Surgeon General. Basically, the president nominates you. It's really Congress that gives you the permission to serve, the Senate confirmation. That's another intrusive, malicious process that you should be aware of. And eventually, it was good for me, but I will tell you that a lot of people I know, and I've met, won't subject them and their families. Because remember, it's not only you going through the process, everybody that's around your circle, social circle, is involved in this process. And so your kids' names get dragged through the papers, any indiscretions you had, whatever it happens to be. And most of the things really never occurred, but people link disparate evidence together. In any event, I made it and went through the processes, and then you wait, because there's 3 paths when you get nominated by the president for a very high-level position. You can get a confirmation hearing and then be kind of treated like a piñata in public and wish you didn't get the hearing. You can be ignored and die waiting on the list, which happens to many presidential nominees, and that's the way the Congress tells the president, we don't like your nominee. Or you can be like me and get a hearing, and you get the hearing after meeting individually with dozens of senators. And I got the call. It says, come to the White House, come to the Capitol, and at 9 a.m. on this day, you're going to have your Senate confirmation hearing for Surgeon General of the United States. So I got there about 10 minutes early. I was pacing in the Senate anteroom. I was diaphoretic. I was tachycardic. I thought, oh my God. I mean, if there's any docs in the audience or people who have to take boards, the Senate confirmation process is like taking your boards in public. Okay? C-SPAN is there, ABC, NBC, every media outlet's there, and sure, they want to report on the news, but they're really looking for a YouTube moment. Okay? They want you to go off script, and that's the headline for tomorrow. So I showed up at the hearing, and a very wonderful senator who I had met, who had befriended me through the process, came out to meet me. And I never used to use his name, but his family I know very well, and they said it's fine. And it was Senator Ted Kennedy. And Teddy gave me a hug, and he said, I want to thank you for your willingness to serve again. But I want to also tell you that, these hearings often are very partisan. And my colleagues may ask you questions that make no sense to you. They may grandstand at your expense. Just remember, it's politics. It's not personal. Because you happen to be the platform of the day. I said, okay, Senator, I get it. So he gave me a hug, and he was holding my hand, and he says, but I want to give you a piece of advice that may help you. And he looked at me kind of in an odd way. And the best way I could describe that look is the look I had after I hugged my son when I sent him off to Iraq on his first tour. This look of, you really know what you're doing? And he said, Richard, I want to tell you something. I said, Senator, anything you can tell me today that will help me get through this arduous process would be greatly appreciated. He said, it won't help you today. He said, but if you get through, and I think you might, because I've asked around, and you did pretty well on all your interviews. I said, okay, Senator, what is it? But he kept talking. He was very reticent. He said, all right, I'm going to tell you. He said, you've probably heard this before, but you can't understand it. I said, well, what is it, Senator? He said, Rich, when you come to Washington, if you want a friend, you need to bring a dog. And I said, Senator, I've heard that before. I think it was Harry Truman who said that. And I looked at him in the eye, and I said, I understand. He looked me in the eye, kind of hugging me with his shoulder, and he looked me in the eye, and he said, you are clueless. I was clueless, because there's nothing that prepares you for the combat zone we know as the Beltway. Nothing. I felt more vulnerable in the Beltway than I did in combat, to be honest with you. And I told the president that many times, and he said, welcome to the club. We went out. I had my Senate confirmation hearing. It took a little over 2 hours, which is light speed in Washington, and I became the first Surgeon General in the history of the United States to be confirmed unanimously by the U.S. Senate. A couple of years later, I was up on the Hill, and Surgeon Generals testify all the time about different things, and it was a terrorism meeting. And it was late. We were a little delayed, and I was chit-chatting with the senators. I went over to Senator Kennedy, and every time I saw him, I always thanked him for how grateful I was for his graciousness in taking me under his wing, and a few other senators as well, but to help me understand the process. And I went over to him again. I said, Senator, I just want to tell you again, thank you for the opportunity. Thank you. He says, Rich, we're happy to have you back in uniform. You're doing a great job. I said, no, but thank you for the advice, Senator. He said, what advice? You mean the dogs? I said, yeah, the dogs. And he smiled and he said, you understand now. I said, Senator, I do understand. I'm a smart street kid. I've been here a couple of years. I said, but I respectfully disagree with you. He said, well, how can you disagree? I don't understand that. I said, well, Senator, I've been here a couple of years now. I learned the ropes, and it's come to my attention that if you come to Washington, you need to bring at least 2 dogs with you. And he said, I don't understand. Why? I said, because during your tenure, one of those dogs will turn on you. And he laughed, and he gave me a hug, and he said, damn, that's better advice than I gave you. Can I use it? I said, use it, use it, use it. Well, the Surgeon General's job is pretty easy. Protect, promote, and advance the health, safety, and security of the United States. On paper, extraordinarily easy. When you try and execute in a hyper-partisan political environment, it's nearly impossible to get things done with any gracefulness or any expediency because of all of the things that you all know and read about every day. And yet, the Surgeon General has a unique position in our history. The position goes back to 1798 when President Adams created the Marine Hospital Service, and it evolved then to become the Surgeon General in the U.S. Public Health Service. But what's interesting is when you do polling, usually the Surgeon General, when you look at polling involving the Surgeon General, turns out to be the most credible, visible person in the federal government. And why? Because you never see the Surgeon Generals getting indicted for anything, okay? You know, they're not in sexual escapades or stealing money or doing stupid things because they recognize their job is not to be the doctor of the Republican or the Democratic Party. You have a more important job. Your job is to be the doctor of the people of the United States, and it rises well above politics. Because, as I used to say as a trauma surgeon, when I was in the trauma room and they'd call and have gunshot wounds coming in, or when I was in combat, nobody comes in on their stretcher just before they die and asking for a Republican or a Democratic trauma surgeon. They want somebody who's going to fix them, period. And through it all, in the history of our Surgeon Generals, all of us have managed to rise above the political fray, and it's tough to stay focused on what the people, on what the people need. The Surgeon General has to develop a portfolio, and the portfolio is important. First, number one, prevention. We're a nation that is drowning in a lot of disease and economic burden that we cause. Tobacco, obesity, and so on. Why is it important to you as Hispanic leaders? Because Hispanic populations are disproportionately represented in obesity, okay, in smokers, a whole host of things. So when you break out the demographics, you start to see the Latino community being disproportionately represented with this disease burden. And there's a lot of reasons for that that go beyond the scope of this. Lack of health literacy, cultural competence issues, access to care, transportation, they're very complex. But the bottom line is, for the people you are concerned with, the viejitos, the seniors in the Hispanic community, they are disadvantaged because they carry generally a greater disease and economic burden, and they have less resources to deal with that. So it was a passionate thing of mine because health disparities and all that stuff, I understand it now, but I lived that. I know what it's like to go to bed hungry. I know what it's like to be homeless. I know what it's like to be wondering where the next meal or where the next bed's going to come from. And we still live in the richest country in the world that has those problems. That's the problem. So as I look at the portfolio, prevention, preparedness, we're a nation that was fighting 2 wars at the time. And when we look at the disease and economic burden, including obesity, they become national security issues. Do you know that for the first time in our history, the Army had to establish a pre-induction boot camp because there were not enough healthy kids to get into the Army? They had to put them through pretty much a finishing school for obesity so they could pass their PT test to get into the Army. That still exists today. And yet, the Hispanic community is disproportionately in that cohort. And yet, our history in the military is incredible. We serve in every war. In my family, going back to my grandfather, my father, my tios, myself, my brother, all served in combat. We have 3 generations of Carmonas, and we see that in Hispanics. Once they're here, they have this sense of community, and they serve because their country asks them to serve. It's real common. So, prevention, preparedness, the issue of health disparities. Probably nowhere more in our country do you see this issue of the health disparities. The fact that disease burden is disproportionately represented in people of color. Hispanics, we're talking about today, but in African Americans, and the greatest health disparities in our nation. Believe it or not where I grew up in Harlem or East LA in the African American community, or even down by the border in Nogales or Texas. The greatest disparities in our nation today are in the original Americans, the Native Americans. Go to a reservation and forget you're in the United States, and the health metrics look like a third world country. Suicide rates, dropout rates, divorce rates, domestic violence, the list is endless, what we call the social determinants of health, and it's right in our backyard. And the challenge, of course, is that for all of these health disparities, when I was Surgeon General, they become political. People would say, Carmona, you're too liberal. Those people need to get jobs. Well, hell, if it was that easy, they would, okay? It's not that easy. It's very difficult. And the fact of the matter is, when I look at the Hispanic community, knowing from my own family, from my 27 tias, who all worked in service industry, my aunts, planchados, who ironing somebody's clothes, maids, the guys working in labor and construction, all became great citizens, paid taxes, lived in little apartments, never owned a car, never took a vacation, but their focus, those viejitos, was get the kids an education and help them assume leadership in this great country, to show the world how important it is to have a diverse, especially Hispanic community. Because like my abuelita used to say to me, Richard, you should be proud of who you are, because the United States wouldn't be here if it wasn't for the Hispanic explorers. This lady had a third-grade education. She could really barely read a newspaper. But she never wavered on how important Hispanic culture was. So when I look at prevention, preparedness, health disparities, and some of the challenges we have in the Latino community today, one of them that comes up is this compliance issue. When you look at the data, you hear doctors all the time say, well, these patients are not compliant. They didn't follow the instructions. They didn't take their medicine. Well, you know, you hear it all the time. If you're poor and you can only afford one medicine, you start splitting the pills, okay? You start eating food that normal people don't eat because you're trying to make ends meet. And so what we find out with compliance is often it is not that the person on the other side, in this case a Hispanic, doesn't want to be compliant, but they have no other choice. And I'll give you an example. I had a big resuscitation one day, and an elderly Hispanic lady came in. We didn't know what happened to her, but she was having a heart attack. We brought her in, resuscitated her. I spoke to her niece who brought her in. She was in her 60s. She looked older. She looked like she had worked hard her whole life. I said, what happened? She said, I don't know. She said, but my, tia has been very depressed, and she forgot to take her medicine the last 5 days, and she knew she had to go see her doctor tomorrow, so she just took all the pills she missed this morning. That's a lack of health literacy. But because of that, she almost died. And those kind of cases are magnified throughout the Hispanic community, especially in the older people. Why? I look at my own abuelita. When she practiced herbal medicine, as probably many of you know historically. When we got a fever, she had the witch hazel on the feet, she had herbs, she had all this stuff. And you know what? Most of the time we got better. We call it complementary and alternative medicine today. If abuelita was still alive, she'd tell you it ain't complementary. This is what my people have done for generations. However, when she had to go to a doctor or the Social Security office, she'd take little Richie with her. So I'm her interpreter. And she goes to the doctor, and she's 70-something years old, and I'm a 10-year-old kid. How likely is it she's going to tell me she's got a vaginal discharge or a breast bump or something? So that still happens today. Many of you know. There's a lack of translation because of the cultural gap. And I remember that very well from when I was a little kid. Everything always seemed to be okay. So let's look at the profile of Hispanic older America in America today. In 2008, we had about 2.7 million senior Hispanics. In 2050, it will be 17 million. 20% of the older population will be senior Hispanics. 70% of Hispanics live in 4 states, California, Texas, Florida, New York. The educational level of older Hispanics is generally much less than Anglo seniors. Hispanic elders tend to stay more connected with family, as many of you who are Latinos here know. Hispanic elders tend to have lower incomes and higher rates of unemployment. Poverty rates for Hispanic seniors are about 20%, more than twice the rate for non-Hispanic Anglos. Hispanic seniors tend to have much less vaccination rate. Hispanic seniors have less access to medical care and prevention services. Generally, have lower benefits, if any at all, at retirement. These are collectively what we call the social determinants of health. Not all of them. It's not an all-inclusive list. But these are the issues that determine how you're going to do in life, what's your chance of success. And in fact, the greatest indicator of health status in the world and the potential for life success is socioeconomic status. If you can't get an education, if you can't be competitive, I don't care if you're in sub-Saharan Africa, or if you're in Bangladesh, or if you're in Puerto Rico, or the Dominican Republic, or Mexico, that holds true globally. So, education, being able to raise yourself up, economics are so important for this population. As one of the most important things I learned as Surgeon General was the one degree I needed to be a more effective Surgeon General after having gone through college and gotten a bunch of degrees and going back to graduate school after I was a doctor. The one degree I really recognized I needed was anthropology, because ultimately all this stuff comes down to culture and understanding the diversity in our country. Many people... I used to sit at meetings in the White House and the Executive Office Building at HHS and such, and they would say, well, let's talk about what we're going to do for the Hispanic people today. I said, because they lump us together as one. Kind of, you're all brown, you speak Spanish, but yet I can remember living in the hood where I first learned about diversity, and there were funny stories, because Abuelita, we'd have the Cubans and the Dominicans and the Puerto Ricans, but when somebody other than where you came from came into the neighborhood, Abuelita would be out there saying, God damn, the Dominicans are here now, the neighbors, the place is going to go to hell, and the Cubans, and they'd say the same thing about us. But you start to see that the diversity is really incredible. We all have a common ancestry, but then if you follow as the migrations occurred from Spain and the cultures that we intersected with, we all became very different. So Cubanos and Puerto Ricans and Colombianos and Mexicanos are all, they're the same, but they're different. And as providers and as leaders in the community, we have to recognize that rich diversity, because one size doesn't fit all in programs and messaging. It does not make it. Our job is to be able to take the tough stuff that we know, science, whatever it happens to be, translate it in a culturally competent, health literate manner to do one thing only: effect sustainable behavioral change in the population we have responsibility for. Simple equation. Extraordinarily difficult to execute because of that diversity, which is why I said I really would have been a better Surgeon General had I had a degree in anthropology, because I had enough science, I had enough of the business side, I understood it, but taking this stuff into all of these diverse communities, which is representative of the United States, and trying to get people engaged and then change their behaviors, don't smoke, walk more, eat less, whatever it happens to be, it ain't that easy. It ain't that easy. So it's extraordinarily important. So what I learned is my background has probably informed me and prepared me better to be a Surgeon General of the United States than any degree I ever had. But those degrees helped because now I understood what I had intuitively learned as a child, growing up in a very diverse community, in a poor Hispanic family, understanding all those socioeconomic issues. So what is it that we know today? Hispanics are the fastest growing minority ethnic group in the United States. Hispanic elders generally are health illiterate. I'm not picking on my people. The general U.S. population as a whole, over half of them are health illiterate. But it's more disproportionately evident in the Hispanic community that they don't understand the science and what they need to do to pursue optimal health and wellness, health illiteracy. Hispanic elders tend to underutilize health and social services. Hispanic seniors have poor access to transportation in general. They distrust outsiders, especially government. There's a cultural clash of the viejitas, or Hispanic elders, in this new digital world with a value system that they're now immersed in, a culture of social media and painfully different values. They no longer feel that they are relevant in society. That's a big issue for our seniors in our communities now. Relevance, because they come from a world where abuelo or abuelita were the kings and queens. And the kids never thought about putting them in a nursing home or assisted living. That was the family responsibility. And I give you a quick example. A few years back, I had taken my kids to Mexico. I was down by the Mayan ruins, and I was in this little village. And everybody wanted to see the sights, but I was attracted to this little bunch of stands where they were selling souvenirs. And right at the end was this little viejita in a rocking chair. And she reminded me of my abuelita. And I wanted to go meet her. So I said, you guys go do what you want to do. So I sat down, and very delicately, I wanted to ask her how old she was. But, that's a bad thing to ask, a Latina. So I spent 5 or 10 minutes before I would ask, telling her how beautiful she was and how beautiful the home was, and talking. But I was really into trying to figure out who she was and what she does. And she's rocking on the chair, and I said, so how old? 106. And I said, wow. I said, how long have you lived here? She said, I was born here, right in that house. I said, who are all these people here running the little stands? They're my kids, my grandkids, and my great-grandkids. Really? And while I'm there for that half hour talking to her, every one of those generation kids were running up. Abuelita, can I do this? Abuelita, what time are we having dinner? Abuelita, what about this? She had a purpose for living. She was the matriarch of the family. She wasn't put out to pasture. She was looked at for her wisdom. They all came seeking her guidance, and she sat in the throne. And I said, well, tell me about your day. They have a little farm around this place. She gets up every day. She picks her vegetables. She plants stuff. She's physically active. She's socially connected. The things that we often forget about that add to longevity in the so-called blue zones. When you find societies, especially up in the Mediterranean, that people live for long periods, especially over 100 years old, that's the missing link. That they're socially connected, that they have relevance to continue living, that they're not put in a corner and then put out to pasture. It's so important, this issue. So, what do we need to do? I would say to all of you, you have created an extraordinary model here. You need to continue and progress in this group that you have formed that's addressing the needs of Latinos. I hope that this can be exported. I hope it can metastasize, if you will, around the country where it can be better. But remember, as your systems become more robust and complex, you potentially become further removed from the population that you serve as you become a bureaucracy. I've seen it for great people who try and do these things. So, we have to embrace health literacy. That is, our ability to translate this complex stuff to the very people that we have the privilege to serve, those viejitas out there, so that they understand, they engage, and they become motivated and aspire to what we aspire to, and that is to improve their health, to reduce the cost of health care, to eliminate the barriers of social inequities and injustices that are out there. And in doing so, we make life a lot better for those people who we owe our legacy to. Thank you very much.